Good evening, everyone. Welcome to this Gyan Pravah episode. This is a podcast series started by a visionary president, Dr. Sunita Tandulwadkar. This is episode number 224 and the host for the 9th of every month. Madam Dr. Sunita is a visionary leader of Fogsi who started with a year's theme, Ek Rashtra, Ek Mission, Swasth Nari Samruddha Vatan, Har Ghar Foxian, which resonates deeply with our mission to empower women and enrich lives. So she has started many impactful initiatives like Know Your Numbers, Sampurna Swasth Janma Abhiyan, Aprajita Sampurna, Do Teeke Zindagi Ke for the cervical cancer vaccine, the Eagle Project to teach endoscopy to all the gynecologists across the country, Arogya Yog Yatra, this is basically for public awareness at religious places, Foxy Anubandh to connect with the other Foxy members, and with along with 7 publications, the Arogya Sakhi app for public for the women to actually know about their health. And so we are actually the Foxy is weaving a strong and inclusive fabric that connects every Foxy into the heart of the association. So these efforts ensure that each member feels valued, involved, and an integral part of our shared mission. So she has initiated a lot of projects related to cancer, like Do Teeke Zindagi Ke for the HPV vaccination, and then the Foxy IMA project to train IMA doctors, and then the Nirmal Banaras Abhiyan, the way to a lot of educational programs for the Foxians regarding the HPV vaccination. So unfortunately, she could not be present here because she is actually getting the RCOG award, the RCOG honoris causa. So she is in London at the moment. So we have Dr. Varsha Baste, who's the vice president of Foxy, and she is again from the West Zone, and she is here with us today. She will be welcoming the audience. Dr. Varsha, madam.
Yeah. Good evening, everybody, and I'm really delighted to be here with my very hard-working chairperson, Foxy chairperson, Sarita Sham Sundar Kale. I've seen her working very hard, and she takes interviews so meticulously, so well knowledgeable people are there for her to give her interviews, and I don't know how she contacts them and really chooses very particular people for such podcasts. And I'm really delighted because I have seen her working so much. At a time, she had conducted 100 programs, contacting 100 OBGYN societies on 5th of February on cancer prevention, cervical cancer prevention day, which I was also in charge of it. And Sarita, last time you had taken an interview of Sangeeta Arun Jetli madam. It was really impressive. The same way, cancer survivor really need to talk. And I've seen Mr. Vanita Menon who also speaks very well Marathi from Mumbai, and she will be interviewing now by Sarita, and we are really looking forward to it. And this is very important for the cancer survivor societies, the group that is formed, for the people to encourage, to support, and give more confidence to deal with such dreaded problems. So over to you, and I will be in the audience link so that you can interview very well. I really wish Dr. Mrs. Vanita Menon to have a healthy life. That is what she has struggled and really managed to deal with such dreaded problem of cancer. And Sarita, you are over to you. Thank
Thank,
you.
thank you so much. Thank you. So, ladies and gentlemen, so this 224th session of the Foxy podcast, we welcome someone whose story is not only of survival, but of extraordinary strength, the resilience, and purpose. So, when faced with the diagnosis of multiple myeloma, which is a rare and relentless form of blood cancer, Ms. Vinita Menon could have chosen to fight quietly, privately, but instead she chose something far greater. She chose to rise, to speak, and to act not only for herself, but for the countless others still facing this battle. Through months of treatment, pain, and uncertainty, Miss Vinita discovered a calling beyond recovery to become a cancer crusader. Today, she is a passionate advocate, a voice for the voiceless, and a source of light and hope in the cancer community. Whether through awareness campaigns, patient support, or tireless fundraising efforts, Miss Vinita is turning personal pain into actually making a public impact. So please help me in welcoming a true warrior, an inspiration, and a champion for change, Miss Vinita Menon. So, Miss Vinita is the Chief Operating Officer of Myeloma Friends Charitable Trust India and is the founder trustee since its inception from May 2012. Welcome, Miss Vinita.
Thank you so much for inviting me. I'm absolutely honored that I have been given this opportunity to come onto this podcast. Though we are not, I mean, myeloma is a blood cancer and we're dealing with gynecological problems, but irrespective of that, eventually everybody's cancer journey is the same. Somewhere down the line, you need that extra, I would say, space, extra kind of drive to be wanting to make a difference in people's lives. So thank you once again for giving me this wonderful golden opportunity to Foxy, to your president, and to your entire group. Thank you so much.
Thank you, madam. So let us just begin with tell us something about yourself.
Uh, yeah. Now, when we talk, the one thing that I find rather difficult is talking about myself. But even then, uh, in terms of my educational qualifications, I did my MSc in micro from Bombay University, followed by a diploma in business administration, and then I did a PG diploma in sports science and nutrition. One of the reasons why I changed stream was I thought people were better to work with than bacteria. So one of the things that really interested me was the effect of nutrition in sports. And I myself was a distance runner at one time and very involved with sports, for nearly the whole of my childhood as well as during college. So that was my educational background, but life took me on a very different, I would say, on a different journey. And one of the things that really always interested me was social work. And I always felt that it was important to always give back to community uh, in whichever way you can. And that actually came from my grandfather, my mother's father, my maternal father, and their family being a very illustrious family. So it sort of imprinted on me. And I was looking for opportunities, and what better an opportunity to have when you're faced with an adversity, which is a life-changing milestone. And that milestone could either be a milestone where you decide to live in fear, or that milestone could be a milestone where you decide that no, I need to face it head on, because that is a challenge that you have. And in lots of ways, since being a distance runner, that played a very important role in my life. Being a runner, being in sports, every race is a race that needs to be run. You get up if you lose, you get up if you win. So that was the philosophy I eventually took when I was diagnosed with cancer. I did a lot of things. I had my own pharmaceutical agency. Worked with a I worked with a NGO which was dealing with kids, especially ninth standard kids, from the point of view of making them leaders of tomorrow. So I think all of that has really helped me be what I am right now.
Yeah, definitely. So tell us about, when you actually had in India, it's a lot of family support. When you're dealing with any illness, actually, family is so important. So how did your family cope with the
Ah,
diagnosis?
that was a very interesting story, actually. And it was, I think there's a little bit of humor in it also.
Mm.
So My diagnosis was, I started in terms of a diagnosis which had a lot of low back pain and a lot of low back pain, a lot of fatigue, a lot of tiredness, which was not explained. And at that time, I had my own pharmaceutical agency. So I was doing a morning and evening also. And I was meeting doctors, and I was just finding that I was finding it more and more difficult to my mobility was going down. I wasn't able to take a day's work. I was sleeping a lot more.
Mm.
Now, I was 52 at that time, and I was also teaching. So I was teaching a sports nutrition module to girls from, as I had mentioned, Dr. BMN College, that is an SNET University college. And I was finding that it was not easy to, it was not easy to manage. And I said at 52, where I could run for a bus, I was not able to run for a bus. That means there is something drastically wrong. They had exams, so I sort of, but I saw the deterioration in me. It was a very, very sudden deterioration, and I couldn't understand it. And nobody really bothers about when you have low back pain because so many women have low back pain. There is
True.
nothing to tell you otherwise. So
Mm.
eventually, once their exams got over and my pain levels really rose, my mobility got affected. I couldn't walk after some time.
Mm.
I decided to go to the orthopedics, this thing doctor, because it was bone back. And within 24 hours, I got my diagnosis. Uh, any diagnosis like cancer hits the family, I would say just below the belt. A lot
Yes.
of people wouldn't know how to deal with it.
Mm.
It's like a fear and flight situation. What do you do? So we went to to Hinduja Hospital, whole thing started. But I was in tears for 4 days. I cried because my girls were young. It's 52. There was so much more going on in my life. And I said, where am I? And the family also did not know how to handle it at that stage. There was, like my father was 78, my mother was 78. It was really difficult. Husband was young. So it was a difficult choice. It was a difficult situation. But one thing that really helped me and helped my family give me the kind of support that was required was after the 4 days of howling and crying and realizing that Google tells you that you've only got 5 years to live. I ended up with I ended up with a website written by Lance Armstrong, and I think I'm extremely grateful for that. It said you can live, but not, like it's for living, it's not for dying. I don't remember the exact situation, but that turned my life around. And from that day, I have never cried for multiple myeloma. I've never cried. Maybe it's something else, but multiple myeloma, cancer, because I've had cancer, there has never been one drop of, one tear. And one of the things that I took was I took responsibility for my disease.
Mm.
I told my entire family, I picked up the phone and told everybody I had cancer.
Mm.
Whoever I felt needed to be told. I
Mm.
shared it with them. I said, look, this is what has happened, and I have cancer.
Mm.
And they were shocked. But I said, that's fine. You just have to deal with it.
Mm.
There is no use, you can't run away from it. You can't say a whole lot of bad karma, this karma, that karma. I said, look, I just need to deal with it. And my acceptance, which I would like to share with a lot of people, I know it's not easy because you undergo grief, you
Mm.
undergo anger, you
Mm.
undergo a situation where you keep saying, why me? But
Yes.
none of it helps. The only thing that really helps to get through is acceptance. So when my family realized that I was the one who was taking responsibility for it, they were in a much better frame to be able to deal with the entire cancer diagnosis because I wasn't crying about it.
Mm.
My like they say that how can you be so happy about it? I said, look, do people cry about when they have a heart attack? No. Do people cry when they have diabetes? No. Do the people cry when they have blood pressure? No. You live with those diseases. You live with those conditions for the rest of your life. And they are bad.
Yeah.
Fine. That's the same situation. I've got cancer. I've got cancer. I've got multiple myeloma. I've got multiple myeloma. So actually, the diagnosis was between chondrosarcoma and multiple myeloma. So I've always believed that between the devil and the deep sea, multiple myeloma is a far better cancer to deal with because it gives you the option of it being treatable, maybe not curable at this stage, but yes, I think the world is moving towards a cure. So that's how I dealt with my diagnosis, and my family dealt with the same.
Hmm. I think that needs a lot of courage, a lot of strength and courage, uh, that the to face, and then also to get through this, the also to get through all the chemotherapy and all the drugs that uh, you have to take. So that's a lot of inner strength is needed. So that's amazing. I think, and also you've had multiple recurrences. I see that.
Yes, yes. So my journey basically started from 2011.
Mhm.
And 2011 March was my first foray into it. And then I was at Hinduja Hospital where I had what they called as a solitary plus. I was in the classical range of multiple myeloma because all the symptoms, all the crab symptoms as we call them, that is hypercalcemia, that is your blood levels in the blood go higher, calcium levels in the blood go higher than 9.5. Mine was I think about 11. Then renal failure. Luckily for me, my kidneys were pretty okay and they've remained. I am so grateful for that. My creatinine levels have always remained stable, though that is one marker. Then your this thing, that is your anemia. I've also been lucky enough that HB levels have been pretty stable, like between 10 to 13. I think that's great. But the bone lesions were there. So I had a plasmacytoma, what they call as a solitary plasmacytoma on my sacrum, covering the left side. So my S3, S4 was affected, so which meant my walking was affected. But once the radiation started, which I underwent about 29 sittings at Hinduja, I was in a much better condition to walk, though it took me another 6 months to actually start walking because the problem at that point, which I would really like to share, and I think now maybe things have changed. This was 14 years back, is rehab is not there post radiation. Very, very important.
Mm.
You need to have a certain amount of physiotherapy. You need to be told that, okay, your mobility will be affected. So this is what you need to do for your improving your mobility. And I just basically, since I was from the field of sports, I understood mobility issues. I myself went and decided I needed some physiotherapy, which really helped because there was a lot of myofascial tightness in the muscle. And once the radiation was done, and basically, I think the plasmacytoma was destroyed, I was in a much better condition. And then the chemo started after that.
Right. So,
So,
what happens is generally, after going through all that, and then when you are in remission, what the patients feel is they don't want to talk about it. They don't want to remember that part of their lives. So, how did you actually think you should form a support group? What made you?
okay, so we have another very interesting story. So what had happened was in 2011 when I was diagnosed, I was working between Hinduja Hospital and Dr. Bhave because I met Dr. Bhave through another friend of mine whose wife had undergone a very monosomy 7. And so he said, please go and meet him. So I said, fine. And at that stage, I was already put on to thalidomide and dexamethasone as my initial treatment. With me, what had happened is because, we have, you grade multiple myeloma. So mine was one of the ones which is what we call as MGUS, that is monoclonal gammopathy of unknown significance, where your plasma cells are a little on the lower side, not very high. You have a certain cutoff to why they call it. And I was a low risk patient. I wasn't a high risk patient with any what we know as additions, deletions, like you have a 17p, a 13q, 11, 14 translocation. So I had none of that. And normally, MGUS may or may not go into multiple myeloma. There's a 1% chance. So when I had all this and I was going through this treatment and I was, working with this, I uh, I was, I mean, the it did really bother me much.
Mm.
I just took it as it is.
Right.
And I was lucky enough that I wasn't at a very high risk, and maybe, sorry, I lost the link, but within 6 months to 9 months, I went into remission.
Right.
So mentally, mentally was a situation that during that time of that 1 year that is from 2011 to 2012, I went into remission in November 2011. And unfortunately, my father was also diagnosed with cancer at that time in 2011, and he was diagnosed with AML with MDS. So he was already terminal. And even though I had a situation like that, I looked after him. I was his primary caregiver with this thing. So when he passed away in 12, he passed away on the 6th of, he passed away in May 12th. The pain I had gone through during this period and the 6 months that I was dealing with him when I was in remission, it hit me to the point to say during this year, I have not met another cancer patient. How do I know? All of them must have gone through situations like I did. They must have had issues which, who can talk about it? You can't talk about it to the doctor. So eventually, then I said, no, I have to do something about it. So that was a thought that I had. And as I mentioned earlier, social work was something that I looked at. So I mentioned this to Dr. Bhave because he was my father's oncologist. And I said, sir, this is what I want. This is what I'm interested in. And as the universe, I always says, always looks for good things. We got in touch. He put me in touch with another fellow patient by the name of Dilip Mewada, who's actually the founder trustee of this organization. And he had underwent an ASCT and he was getting out of it. And then Dr. Saikya, his doctor, with Dr. Bhave, said, there is no support group for multiple myeloma in India. Will you take up the challenge? We did. And that's where we are 14 years later.
Right.
A small this thing, it was just that the need of the hour. And the fact that when I was asked to join, there was no hesitation. I just joined. And I think, as I always say, sweetheart, the uses of adversity. That's how we started off with myeloma friends, and so my journey in multiple myeloma has been parallel to myeloma friends. And I think I am extremely happy that being a part of it, being such a senior person in it also made a lot of difference. Because if you've got to smile, then you've got to smile for everybody. You can't smile for yourself and not for anybody else. So I think that gave me a lot of strength and courage.
Very good. So how did you actually connect to patients, and how did they join? What was their reaction like?
Okay. So when we initially started, we were three doctors and another 3 or 4 patients. And initially, we were just finding our way through. But in 16, I underwent another relapse. I underwent a relapse, actually, not another relapse. I underwent my first relapse. And at that time, I said that if this organization has to really mean something, then we need to have a patient outreach.
Mm.
So I was still on treatment and I was still having my bone strengthening, injections, Zoldonate. And I used to go to Dr. Bhave's clinic at that time and I spoke to him. I said, Dr. Bhave, this is what it is. What do you think about it? So he said, yes, yes, Mr. Menon, let's just start off. And our first meeting, because we needed to connect with patients, patients needed to connect with us because we needed to grow together as a group. It was not just having people talking about it, but people needed action. We needed to do something about it. And there was no support group in India by and large at that time. This was in 2016.
Mm.
So our first meeting, so within maybe a month, we had decided that needs to be done, and let's just start off with, meeting people. So our first support group meeting that we had, there were two couples, out of which the husbands had multiple myeloma, and one needs to pray for their soul. They're no longer with us, but they were there that day. And the rest of us were Dilip, myself, and Dr. Bhavi, and there were a couple of other people. And it was just a group of more others than the patients, let's put it that way.
Right.
And we started from there, and then we started direct meetings, group meetings every second Saturday of the month. We connected with doctors, they gave us their patients, we connected with the patients, and that is how we grew. Then we also associated with the Indian Myeloma Congress. So through them, we also got a lot of patients. So right now we are at nearly more than 2,000 plus patients with 14 groups all over the country from various cities. We would love to expand to 29 states all over the country to be there for myeloma patients. So that's how we started, slowly and steadily. And over a period of time, we've had people coming in, sharing their knowledge, sharing their views. And our actual acronym is EASE, that is education, awareness, support, and evaluation. Those are our four pillars of Myeloma Friends Charitable Trust. And that's where we work with, extremely important to educate a person, extremely important to make him aware of what kind of disease he's dealing with. You also need a lot of emotional support when somebody says, I've taken Len, I've got a bad rash. What do I do with it? I've got diarrhea, I've got constipation, I've got high fever. What can I do? And that's where we come in.
Right.
That's how we connected and we grew. That is the way we grew.
So you
And we are
connected,
still growing.
you have physical meetings every.
Yeah. Now, we used to have physical meetings and we used to also travel for them. But then, I would say a big thank you to COVID, because we went into webinars and we were able to connect with a lot many people across the country, because then we had more people coming from Ludhiana, from Chandigarh, from Delhi, from Pune, from Gujarat, from Orissa, from Calcutta. So it was easier to connect with people at that stage. Though we did have physical meetings, we used to go there, we used to conduct maybe a 2-hour meeting, share our views, share our stories, and tell people that they need to accept the disease and they need to live with it happily. Because eventually, as you really look at it, when you're dealing with multiple myeloma, you are visiting the doctor maybe once in 3 months if everything is fine, which is 5 minutes. But what about the rest of the 3 months and that one day of that 24, 23, 45 or 23, 50 minutes? You're on your own. And that's where the emotional support is required. And that's where people need to know that we are there to hold their hands and to see them through.
So what were the challenges that you faced? How did they accept? How did the patients accept? How did the physicians accept?
I don't think we had very much of a problem. Sometimes, yes, physicians say, there have been a few physicians who've said that, oh, we manage.
Mm.
But, like we sit with the patient and talk to the patient. But the problem is sometimes the patient comes back, like he's not wanting to go to the physician because you know that the side effect is there because the drugs do give you side effects. Like a drug like lenalidomide gives you a very bad rash. I have been on it for the last 4 years, but whenever I do take it, whenever I start it, I break out into a very bad rash. I break out into swelling, I break out into a rash. I'm not going to run to the doctor for it.
Mm.
I know what to do with it. But
Mm.
then there are some people who get very upset with it. So then they get onto the group and they'll say that, look, this has happened. So we turn on and tell them that, look, that is a part of the deal. Don't worry about it. Just take this, and you will be fine. So from that angle, there have been physicians who've sent patients to us and said, especially when it comes to a stem cell transplant, and said, please sit with the patient and tell them what it is all about.
Right.
Explain to them.
Mm.
So it's like when you have been there and done that, or you're doing that, if you're practicing what you're doing, it's much easier. The patient goes back feeling that, okay, fine, the world hasn't come to an end. It's just a part of it, and they would get better with it. So some accept it, and some may or may not accept it. Well, there are always two sides to a coin.
Mm. Also, a lot of times, they feel that if they are, if they don't complete the treatment and then they just stop going to the doctors, stop the treatment, and then they come with a relapse. So this is where I think a lot of help from organization like yours is so important, that they have to complete the treatment. Otherwise, it's going to
Well,
come.
and the thing with myeloma is that you're never there to complete. You never can really complete a treatment because it's an ongoing situation. Now, yes, in between, if you're in remission, we have a myeloma panel, and one of the tests on it is called your lab diagnostics, which are very important, is your CBC, your complete blood count, your creatinine levels, your what we call as the M spike, the M protein, the serum protein electrophoresis, where there is a very specific protein which myeloma cells give, and which comes in comes as a graph. And if it is present in your blood, then well, that's multiple myeloma, depending upon what the ranges are. And then we have something called the free light chains, the kappa and the lambda chains. Now, again, those are very LDHs there, then beta to serum microglobulin. Now, these are very important diagnostic tests. So normally what happens is when you're on treatment, you're on long-term treatment until and unless your M spike or your serum protein electrophoresis and your free light chains are not within the ranges that they're supposed to be. Usually, if there is nothing, there's no single bump in a serum protein electrophoresis report, no monoclonal band seen, well, you're through for by and large most of the time, and that would mean you are in remission. I'm in remission right now, so one of my diagnostic tests is the serum protein electrophoresis, which I personally do every month to make sure that things are within. But there is another test that we do on a regular basis every 3 months. That is your serum free light chains, both quantitative kappa and lambda, but quantitative and qualitative. So when you have this kind of a situation, you're on medication for a long time until you're on remission. And with MM, you don't really know what's the deal later on, but you hope that things would remain as a progression-free survival. But you are on maintenance through a long period of time to be able to sort of suppress the disease and break it. So there is no time, really speaking, or without medication.
Right. Oh, you got muted.
I myself, I'm on medication. I mean, it's been 4 years now since my transplant.
Right. Okay. So, how did the families, was there resistance from the families when you were actually talking to the patients?
There has never
They're
been
trying
any
to form,
resistance from the family as
when you
such.
had the support,
You're very
the different
soft.
the families of.
Can't,
Hello, can you hear me? Can you hear me?
yeah,
Yeah,
yeah, now, yes.
yeah, when you were actually talking to patients, how was the family reacting? Were they accepting?
Uh, okay, now you have varied responses, because what happens is you have a spectrum
Mm.
of responses where in some cases there is a lot of fear because nobody knows anything about multiple myeloma. What is multiple myeloma? The first question is, what is multiple myeloma?
Yes.
Now, most people would say, okay, it's a plasma dysgraphia. It's a B cell, it's a it's a T cell issue, sorry, B cell issue. And it goes on that way, but actually you don't hear about multiple myeloma. And most people will say, what? So I said, no, it's a sister concern of leukemia and lymphoma, the other part of it, in terms of your immune system. But it still doesn't strike a bell because by and large, multiple myeloma is not a very common disease. It is
Mm.
not seen on a regular basis. But also the fact is that it is a treatable cancer, but not a curable cancer. All the other blood cancers will have an end to it at some point. Multiple myeloma doesn't. So in such a situation, you have these, I mean, families sometimes are hit very, very badly.
Mm.
And the major issue that we are seeing here is that, see, by and large, multiple myeloma has been known to be a disease which hits you after the fifth decade of life, by and large. But what we see in India is that the percentage of people who are in their 20s, who are in their 30s, who are in their 40s, getting multiple myeloma. Now that, and those patients sometimes can have it really bad. Like you can end up with a fractured spine because you have lesions on your spine. You might end up with a problem with your hip because all your long bones are affected. So in such a situation of these three, of these varied, what to say, demography, it's very difficult for families, some families, to accept the disease. Because it's not easy to be told that, look, it's treatable but not curable. And it's
Yes.
long term. It's not today, tomorrow. So there is no end to it. You get well, there is very likely to be a relapse. If you're lucky enough not to have a relapse, life is cool. But it doesn't normally happen. It is understood thing that yes, with MM, a relapse is there somewhere down the line. So families, in some families, they will say, please don't tell my father, please don't tell my mother. We don't want them to know. In
Yes.
some families, they will accept it, but then there's a lot of fear.
Mm.
But one of the things that I always believe is that if you accept the disease, your road is always a lot better. If you fight the disease, if you believe that why me, or why should it happen to me, or is this karma, like a lot of people talk about it, you will never be able to accept the fact that your body is in this condition. You're fighting it constantly. And if you fight it, I because you're fighting the medicines, you're fighting the treatment, you're fighting your mind, and everybody knows that when you are immune compromised, the mind and body connection is the one that gets the beating. And it can escalate because of that. If you get your mind and body connection in a much better frame of mind, if you manage to look at it positively, you manage to look at it in a manner that, yes, okay, fine, I've got it, matter is over. In whatever situations that you are, you would definitely have a more positive outcome. But families sometimes don't want to tell their patients. But especially if it's the father and son or mother and daughter or mother and son, that is the situation. But in some families, yes, they do come across it.
Yes, and the other thing is, have you, have you made some more crusaders in your group?
Like me, few, very, very few.
Right.
I think there have been crusaders, but taking the lead or taking the role ahead and saying that, look, we want to make a difference in people's lives. There are a few people who would like to, but eventually it's a lot of commitment. And also the fact is, as a as a personality, you need to be able to reach out to people. So you have that situation of being maybe an extrovert or maybe this thing where you make a difference with, like, when we meet people, you say, okay, fine, and the person wants to talk to you. So that openness is very important. That person should feel that, okay, if I can talk to this person without having any kind of objectivity or subjectivity or nothing, but I just want to talk to that person. So I haven't really come across anyone who would say that, look, we would like to be in this place. So from the patient's point of view,
Okay.
though we are actually looking at developing leaders within our organization so that the next step that can come up can have other people who would also be involved with this, who would also be able to give their time, and who would also be committed to making a difference in people's lives.
Yes, that's very important, I think. They
Yeah.
should
A
actually,
legacy is very important.
they should believe that it's going to make a difference. That belief is very important. The other thing is, how does your organization work? So how do you get your funding, and how does the how do you manage your operations?
Well, the thing is, initially when we started, though we had a board of trustees, the basic work that was done by our founder trustee, the late Dilip Kumar Mevada. He passed away about a couple of months back, and myself. So we used to be actually, Dilip's wife was also very involved with it, because as a caregiver, she was very, very involved with his treatments as well as also with the organization. Now, what had happened was, since there were only the three of us, and we managed all of this, we managed the WhatsApp groups, we've managed this thing, we managed the traveling and everything. So then, post that, like once we started expanding, we basically worked with WhatsApp groups. So we didn't need too many people at that stage, and we managed within ourselves. So, but right now we are also associated with Yodhas. So Dilip used to do a lot of counseling one-on-one, especially with a lot of patients. And I do the counseling, but not maybe, I do it more collectively. And, though I do speak to a lot of patients whenever they come, but what we find now is that a lot of other patients have also started sharing their views since he's not been there. And we have Dr. Gayatri from Yodhas, who also assists us, because their group, Yodhas, also has a group which is dealing with, but they deal with a lot of blood cancers. That group was started in Delhi by Rahul Sharma, but they're not specifically into multiple myeloma, though Dr. Gayatri herself is a multiple myeloma survivor for 24 years and a very, very positive personality who's, reached out to many, many patients, and Dr. Ganju. But this is how right now we work, and we've not got a very large team. Now I'm looking at building up a team because Dilip is not there, and we need to sort of look at things differently. We need to expand. We need to also reach out to people. Where fundraising is concerned, we didn't get into too much of fundraising because we were not really assisting in patient treatment because our treatments are very expensive. So if you're looking at drugs, like suppose I'm looking at lenalidomide, it's say if I'm getting it at a distributor's price, this is about 2,700 for 2 bottles. But, and it's a 21-day cycle. But we have other drugs, especially when you get into something like what we call as refractory relapsed multiple myeloma, where all your lines of treatment have been exhausted and things are, meaning you might be a case for palliative care. Over there, we have drugs like immune targeted therapy called daratumumab. Now it's come under this thing, so the GST has come down it, and teclistamab. Then we have talquetamab. Now these are drugs which have just come into the market, and they are very, very expensive, beyond the reach of the normal individual. The earlier drugs, because now they are generic and they are being manufactured in India, are more affordable for the general population. So we have not got into it as yet in fundraising, but we are looking at fundraising now because we want to raise the platform for research in multiple myeloma, especially the non-medical one, where you are talking about what is the impact of patient support? How can patients benefit more? What is it that can be done better? And actually speaking, we are now, I myself did my this thing, patient advocacy course with under the National Cancer Grid as and Patients Engaged called PARC. So the patient advocacy for clinical research, the research and clinical this thing. So I can't quite remember the total this thing. So Park is something that, so we had this entire program about 3 months where we went through various kinds of uh, modules. So right now, so that is also part of research. So what we are looking at in terms of funds, not direct funding for the patient as such, that is one aspect we'll be looking at for in the future. But right now we're looking at research, and we've got 2 projects on. We've got one project on CTRI, that is your registry for clinical trials. We are doing a project on that with PACER. The lead is Dr. Pooja Sharma, and we are doing this. So we are trying to build up some amount of research in this field, but non-medical. And the other part would be events, helping out patients, looking at various other aspects of how you can make an impact and make their lives better. So these are a couple of things that we are thinking of. But
Right.
one of the things that I feel very strongly about is the input of understanding the Indian diaspora in multiple myeloma. Is what is it that they require? How would you manage the finances? What is the insurance? Because there is no insurance. How are you going to manage drugs? What is it that, like whether it's a cut paste? Can they do with less? Can they do with more? Can you economize? Can you and still get the same kind of effects? There are lots and lots of things, and eventually it's the patient that needs to benefit from everything.
Yes, absolutely. So, do you know of any other, support groups for any the cancers? Now, for gynecological cancers, I don't know myself because this is something when I was working in the UK, there were support groups, and when there was a patient, they used to be referred to that. I mean, they used to connect to them, so that helps them go through their journey. So it sort of eases out because of because always the patient feels that they are the only people that who are suffering. But if they connect to similar patients, then they feel a lot better. So but however, I haven't come across these groups myself, especially for the gynae cancers. So maybe if we can actually try and connect with them.
Yeah, I actually haven't come across any
Mm.
because we in the space that we are in, we have a lot of support groups for pediatric cancers,
Right.
blood cancers, then you're saying Jude's for. So there has, and then you have support groups for the nutritional part of it. But
Mhm.
specifically adult cancers, besides breast cancer, I
Mm.
personally haven't come across it. The Lymphoma La Leukemia Society is there, CML, they have their own, the Max Foundation, which they have, that is your chronic myeloid leukemia. But in terms of gynae cancers, that is your cervical cancer, your ovarian cancer, I personally haven't come across any as such
Mm.
in terms of that, because I feel people need to understand that support is very, very important. Everything cannot be given to the doctor to do. It
Yes.
eventually is what would you say? It's a mind and body game.
Mm.
And and these are psychological and sociological problems that you will face. Depression, there is mental health issues, your hormones are all over the place. So you're going to have a lot of issues where that is concerned. So
Mm.
there has been no kind, I mean, from my understanding, I haven't come across any of that. But I do hope that I will be able to, and maybe we can make our inquiries.
Yes.
Definitely.
Yes. So, and I mean, talking about other things, how do you actually de-stress and relax when you're uh,
Yeah. Now, so stress. I have my off days and my on days, as I call them, and sometimes I have my blah days and my unblah days. But one of the things that I did find personally at a personal level is I do a lot of crochet.
um,
So crochet is something that I learned while I was in hospital with COVID. I did have COVID, but I got out of it very easily. That's God's grace.
mm,
And it is very, very therapeutic.
mm,
Besides the fact that I think my NGO keeps me so busy that it's like that is therapy enough. When you're talking to 10 people is therapy enough. So, and I have my family and I do a lot of other things. I'm also involved with insurance, so I also deal with insurance. And relaxing is something that maybe walking, but I would say that I've not been that physically active, though one should be, because exercise is definitely very important. Uh, from that, also the fact is that I think yoga, though I'm not too much of a fan of yoga, but yoga does make a major difference, especially as what I would suggest, I would say is before a stem cell transplant. Oh, it makes amazing kinds of difference because it makes you stronger, it develops your body, it develops your breathing, it develops your mind. We presently, as a group, have a yoga therapist who herself is a multiple myeloma patient. Hina Joshi, she is the one who now conducts yoga classes for our patients.
wow.
Free.
Oh, nice.
So she volunteered and she felt that she wanted to give back to the community. And she herself, being a multiple myeloma patient and a yoga therapist, she knows exactly how it works.
Mm,
So these are various ways of relaxing. A lot of people like singing, they
mm,
like dancing.
mm.
So, but yes, we would like to, involve a lot more people for stress and relaxation, meditation, and also maybe look at alternative options that one could have in terms of complementary medicine. But yeah, for me, I enjoy myself. I live by the beach, so my relaxation is going out, seeing the sea.
That's wonderful. Dr. Varsha, do you want to say anything? Ask her anything?
No, I had a message actually for, I would say, for those listening to the podcast, because a lot of people have listened to the podcast.
Hmm.
One thing, cancer is not the end,
Hmm.
and it depends on how you take it.
Yes.
I do understand that most people will talk about cancer as no hope,
Hmm.
but all cancers are not the same. And
Hmm.
there is always hope at the end of the tunnel. And that hope lies in you. Is
Yes.
if you decide to make that your mantra,
Hmm.
then nothing will ever stop you from being fine or doing well. So,
Fantastic yoga, Mrs. Vanita Menon. I am really taken aback by your experiences and your positive attitude towards fighting spirit also. And Sarita, you really extracted very well whatever she
Thank
should express. And you really gave her impetus to give her experiences, and it really enriched our experiences also, what you go through, yoga, stem cell therapy, and whatnot. You really won the battle, I think, and you are really role model now, forming this multiple myeloma group, and you are inspiring and you are giving so much confidence in the life of such people. It's really noble thing you are doing. I really congratulate you, Mrs. Vinita Menon, and I am really saluting you for your attitude also.
I know,
So
it's just, it happens. I think you just take life as it comes.
Hmm.
very
Yeah, we
nice.
as doctors can only, prescribe medicines and this drug, that thing, but it's the support which is so important for the patients.
It's extremely important. I think that is the only thing that you would see would increase the positive outcomes and better progression-free survivals.
Yes. Absolutely.
And
It's
I think the doctor would also be happy about it.
yes. So it's been wonderful speaking to you, Miss Vanita, and thank you for joining and sharing your experience. Thank you, Dr. Varsha, for joining. It's been really nice having you.
Pleasure having you me here. Thank you so
Thank
much.
you so much. And
Thank
thank you for giving me the opportunity to talk to you to with on this wonderful podcast, especially in the month of September, which is the myeloma awareness month.
Wow, good, very good.
you. Actually, Gynecological Cancer Awareness Month, so we should maybe think of forming a support group on in this month.
And if you want any kind of help from me, you're most welcome to always reach out to me. I am always available for these things.
Sure, sure.
Nice. Good night. So nice of you. Thank you. Nice meeting you. Nice hearing you also, Vinita Menon. Really
Thanks
good.
for
Very
supporting.
nice podcast. Very well taken interview also.
Thank you, ma'am.
Congratulations. Proud of you, Sarita.
Thank you, madam.
Thank you so much. Thank you. I mean, this has been an amazing opportunity. I do hope I've reached out to as many people as I can and touched a heart to say cancer, so what, overcome it.
Yes.
So I do hope that will be the message, and we all hope for the best.
Yeah, so
Yes.
this will be on YouTube, madam. So once the YouTube link is generated, I can share it with you. You can share it with more.
Definitely, because what we will do is I will also share it with the GMAN, this thing with the IMF. We are also associated with IMF. So what they are doing is they are doing a lot of stories on awareness. So this goes as their hashtag, and it will go through various other countries also. So I think this is an amazing platform, and it's really made me very, very happy.
Thank you. Thank you so much.
Good
Thank you.
night. Good night.
Thank you.
God bless.
Bye. Good night.